Hello Professor. In this video I will be discussing about two cases which are related to outpatient psychiatric crisis, and I will be discussing about my thought process, assessment and initial management steps for each case, and I will talk about how I would address each case as a psychiatric mental health nurse practitioner. I made a Word document for each case so that I do not miss important information. So I will be reading from the Word document that I made. Um, I want to talk a little background about each patient, and our first patient is 45-year-old male with major depressive disorder and suicidal ideation. He has two children. He has a history of a major depressive disorder which began in his 20s, and he also had a past pornography addiction. Both of these have been addressed over the years through therapy and medication. He has been stable on citalopram 20 mg daily, and his therapy has been supportive, helping him maintain both his mood and relationship. For the past 5 years, his marriage had been stable, and he reported he has no issues with his prior addiction as well. But today, he presents to the clinic visibly upset and emotionally distraught. He recently discovered that his wife has been having an affair for 2 years, and she has left the home with their children and initiated divorce proceedings. And he also hasn't spoken to his children for about a month. He reports feeling hopeless and devastated, saying things like, I don't know why I bothered improving myself, and I don't know how I can even go on. So he also reports drinking heavily, at least 6 pack of beer nightly, and when asked directly about suicidal thoughts, he admits to having them, and including a plan to shoot himself, noting that the only thing keeping him away keeping him from acting is his children's, and he also fears he may lose contact with them permanently. So, given this history, my first priority is a thorough suicide risk assessment. I would ask clear, direct question to understand his intent, plan, and access to means, as well as protective factors. In this situation, the patient has active suicidal ideation, a specific plan, access to a firearm, alcohol use, and social isolation. These are all high risk indicators. The combination of severe stress, which are the loss of his wife and children, along with alcohol use, places him at imminent risk for suicide. The next step is to ensure immediate safety. So I would keep him in the clinic and avoid leaving him alone. Assess for and remove any access to firearms or other lethal means, and also contact local crisis services or call 911 to arrange emergency transport to an inpatient psychiatric facility. So throughout this process, it is very important to document everything carefully, um, which would be his statements, suicidal plan, risk factors, protective factors, and also to communicate clearly with the on-call psychiatrist and crisis team. This ensure a safe and coordinated transition of care. Once stabilized, long term care would include re-evaluation and potential adjustment of his antidepressant medication, psychotherapy focused on grief, coping skills, and relapse prevention, addressing alcohol use and other maladaptive coping strategies, and also encouraging re-engagement with family or social support system. So as a provider, um, it is also important to reflect on our own potential biases. For example, we might unconsciously judge his coping methods or drinking, but in crisis, empathy is very important. My role as a psychiatric mental health nurse practitioner is to support him through his acute pain, ensure safety, and offer hope that recovery and connection with his children is possible. So, in summary, this patient is in an acute suicidal crisis, so immediate assessment, safety planning, and emergency interventions are essential, and followed by careful long-term support and therapy. So this is about the first case, and in the next video I will be talking about another case, um, which is a 19-year-old female with postpartum psychosis.